All right, let's dive into something that sounds like it's straight out of science fiction but is happening in hospitals every single day: radiopharmacy. Now, before you get intimidated by that word, just think of it this way. We're going to be talking about medicine's tiniest, most precise secret agents. I know, it sounds completely backwards, right? We spend our lives hearing about how we should avoid radiation. But what if we could actually harness it, tame its power, and turn it into a tool so precise it can literally hunt down disease inside our bodies? Well, that's exactly what we're going to explore. And that brings us to the field of nuclear medicine. Now, here's the genius part. You take a normal atom, but you use a version of it that's radioactive, a radionuclide. Physically, it's giving off all this energy. But, and this is the key, chemically, it behaves exactly like its normal, stable twin. The body can't tell the difference, which means it can sneak into all sorts of biological processes, like the perfect undercover agent. So you might be wondering, okay, but is it safe? And the answer is a resounding yes, all thanks to something called the tracer principle. It's brilliant, really. You use such a microscopic, unbelievably tiny amount of the radioactive stuff that it's basically a ghost in your system. It's there, we can see it with our special cameras, but there's so little of it, it doesn't actually interfere with anything. We get to spy on the body's inner workings without changing a thing. And if you're wondering how well this works in the real world, well, look at this number. We're talking about 50 million, that's 50 million clinical PET scans that have been performed without a single reported side effect from the radio tracer itself. That is a truly mind-blowing safety record, and it's all because of how elegant that tracer principle really is. Okay, so we know they're incredibly safe, we know they're effective, but how are these amazing molecular spies actually put together? Let's look at the anatomy of one of these things. Probably the best way to wrap your head around a radiopharmaceutical is to picture it as a tiny little vehicle. It's built for a very specific mission with a specific destination in mind. And just like any vehicle on a mission, it really needs two key parts: something to steer it and get it to the right place, that's the guide, and something to power its work once it arrives, that's the engine. So, let's break down those parts. First up, you've got the radionuclide. That's our radioactive engine, the part that's actually emitting the energy. Then you've got the targeting molecule. This is our guide. It's a molecule specifically designed to lock onto one particular thing, like a unique protein that you only find on cancer cells. And then you have the piece that holds it all together, the chelator or linker. You can think of it like the trailer hitch, making absolutely sure the engine and the guide stay connected for the whole journey. All right, so we know how they're built. Now let's get to the fun part, the mission. Because the kind of engine you pick, that radionuclide, well, that changes everything. You can really boil it down to two primary missions. The first one is diagnosis, or imaging. The entire goal here is just to see the disease, to make it light up on a scan so doctors know exactly where it is. The second mission, that's therapy, and it's a lot more aggressive. The goal here is to fight the disease, head on. And which mission the agent goes on isn't some random choice. It all comes down to physics. Different radionuclides give off different kinds of radiation, and each kind has totally different properties. The real art of radiopharmacy is about matching the perfect kind of energy to the specific job you need to get done. And this chart really tells the whole story. Just look at that range in tissues column. Gamma rays are like marathon runners. They can travel a long way, easily passing right out of the body to be seen by a camera. That makes them perfect for imaging. But alpha and beta particles, they're like heavyweight boxers. They deliver a massive punch of energy over a super short distance, sometimes less than the width of a single human cell. So here's the takeaway. For imaging, to see the disease, you pick a gamma emitter. It basically acts like a glowing tracking dye for a PET scanner. But for therapy, to fight the disease, you choose an alpha or beta emitter. These guys act like microscopic, GPS-guided smart bombs, delivering a lethal dose of radiation right to the doorstep of a cancer cell, while leaving the healthy neighbors alone. Now, designing these molecules is one thing, but actually getting them from the lab to a patient is a completely different kind of challenge. This entire field operates in a constant, high-stakes race against time. And this quote just says it all, doesn't it? Because these medical spies are radioactive, they are literally disappearing. Their power source is fading from the second they're created. That means the entire chain of events, making them, testing them, shipping them, has to happen with breathtaking speed and precision. Take fluorine-18, for example. It's the most common isotope used for PET scans. Its half-life? 110 minutes. That means in less than 2 hours, half of the radioactivity you started with is just gone. Wait another 2 hours and you're down to a quarter. This is not a job with comfortable deadlines. It's an all-out sprint. And that ticking clock is just one piece of the puzzle. The chemistry involved in attaching the radioactive engine to its guide molecule is super delicate and has to happen fast. And on top of all that, every single dose has to go through rigorous quality control to make sure it's pure, potent, and safe for a patient. It's an incredible feat of science and logistics that happens every single day. So with all this amazing science, where is it all going? Well, the future isn't some far-off dream. In many ways, it's already here, and it has a name, Theranostics. Theranostics is this beautiful, elegant idea that brings together the two missions we just talked about. I mean, it's right there in the name. Therapy plus diagnostics. It's a single strategy that uses the exact same molecular guide to both see the disease and to treat it. And this simple phrase is the whole paradigm shift. Just imagine this. A patient comes in. First, you give them the molecular spy with a diagnostic engine, the gamma emitter. You run a scan, and you can see with your own eyes. Yes, the agent is binding to the tumors. You see the target. So then you take the exact same guide molecule, but you swap out the engine for a therapeutic one, an alpha or a beta emitter. You give that to the patient, and you know with total confidence it's going to the right place. You get to see what you treat and then treat what you see. It is the absolute definition of personalized medicine. This fundamentally changes how we approach medicine. It moves us away from one-size-fits-all treatments and towards something truly tailored to a person's individual biology. And it really leaves us with this incredible question. Now that we have molecules that can both find and fight disease, what's next? What new frontiers are we going to unlock in this amazing world of personalized medicine?